Dr. Hee Mun, every time I see an arterial blood gas, I freeze. The numbers just don't make sense.
Can you teach me how to think through it? Of course. Forget the formulas. Let's solve it one question at a time.
Dr. Hee Mun, I don't even know where to start.
Whenever you feel overwhelmed, start with the same 3 questions. Before solving any acid-base disorder, remember these 3 questions. They will guide your thinking every time. Start with the pH.
The pH is 7.18. That's below 7.35. Excellent.
Excellent. Before asking why, always decide whether the blood is acidic or alkaline. Excellent. We know the patient is acidemic. Now let's look at the carbon dioxide. It gives us our next clue.
They're both moving in the same direction.
When the pH and the CO2 move in the same direction, think metabolic. When they move in opposite directions, think respiratory.
Same direction, metabolic. Opposite direction, respiratory. Both arrows point in the same direction.
Exactly. The kidneys cause the acidosis. The lungs are simply lowering carbon dioxide to compensate.
The arrows move in opposite directions. The lungs must be causing the problem.
Exactly, because the lungs can't remove it. The kidneys will try to compensate. The primary disorder is respiratory acidosis. Luna are moving in the same direction.
Same direction means the primary problem is metabolic. This is metabolic alkalosis.
Luna, these move in opposite directions. Diagnosis?
Opposite directions mean the lungs are causing the problem. This is respiratory alkalosis.
Excellent reasoning, Luna. Luna, walk me through your thinking.
The patient has acidemia. The pH and PaCO2 move in opposite directions, so the lungs are causing the problem.
Excellent. You're recognizing the pattern instead of memorizing it. Excellent. We've identified a respiratory disorder. Why is the bicarbonate increased too?
Why is the bicarbonate also high?
What do you think the body should do to help?
Maybe the kidneys should keep more bicarbonate?
Excellent reasoning.
The kidneys keep more bicarbonate and remove hydrogen ion. Carbonate level rises.
Exactly. The kidneys aren't causing the problem. They're helping restore the body's acid-base balance.
The kidneys are reabsorbing bicarbonate, but how do we know if the compensation is appropriate?
We calculate the expected bicarbonate.
They match!
Exactly. The patient's bicarbonate matches the expected bicarbonate. What do these arrows tell you? The patient has alkalemia.
The pH and PaCO2 move in the same directions, a primary metabolic disorder.
Now let's figure out why the carbon dioxide increased. We've identified a metabolic disorder. Now here's your challenge. Canope, can you figure out why the CO2 is increased?
But why is the carbon dioxide high? If the blood is too alkaline, the body should try to become more acidic. Maybe the brain tells the lungs to breathe more slowly. Less carbon dioxide is exhaled, so more stays in the blood. That's why the PaCO2 rises.
The lungs aren't causing the problem, they're helping.
We know the lungs are retaining CO2, but how do we know if the compensation is appropriate?
We calculate the expected CO2.
They match!
The patient's CO2 is close to the expected CO2. Luna, what do these arrows tell you?
The patient has acidemia. The pH and carbon dioxide move in the same direction, so this is a primary metabolic disorder.
Excellent. Now let's figure out why the carbon dioxide is low.
Dr. Hee Mun, if the kidneys cause the metabolic acidosis, why is the carbon dioxide low?
Think about what the body lists.
The blood is too acidic to make it less carbon dioxide.
Excellent. Let's watch what happens.
More carbon dioxide is exhaled, so the carbon dioxide level falls. The lungs are helping make the blood less acidic.
Exactly. That's respiratory compensation.
We know the lungs are lowering the CO2, but how do we know if
The compensation is appropriate. We'll use Winter's formula to calculate the expected CO2.
the patient's CO2 is slightly higher than the expected value?
Good observation.
Now I know the 3 questions to analyze every ABG.
Excellent. Another acid-base mystery?
Yes.
Let's think like a doctor.